Hello students, welcome to today's class. In this lesson, we are going to talk about characteristics of health behavior and barriers to health behavior. The main objectives in this lesson are to understand what is health behavior, what are the various characteristic features of health behavior, and also we will try to understand what are those various barriers which come in between health behavior. The role of behavior in health has been receiving increased attention in countries around the world because people's health habits, that is their usual health related behaviors, influence their likelihood of developing chronic and fatal diseases such as heart disease, cancer and HIV/AIDS. Illness and early death could be substantially reduced if people would adapt lifestyles that promote wellness, such as by eating healthful diets and not smoking. Now coming to definition of health behavior. Gochman in 1997 defined health behavior as those personal attributes such as beliefs, expectations, motives, values, perceptions and other cognitive elements. Also personality characteristics including affective and emotional states and traits. Also overt behavior patterns, actions and habits that relate to health maintenance, to health restoration and to health improvement. In the broadest sense, health behavior basically refers to actions of individuals, groups and organizations as well as their determinants, correlates and consequences, which include social change, policy development and implementation, improved coping skills and enhanced quality of life. Now let us understand how health behavior is classified. Health behavior is any activity people perform to maintain or improve their health, regardless of their perceived health status or whether their behavior actually achieves that goal. Researchers have noted that people's health status influences the type of health behavior they perform and their motivation to do it. To understand these differences, Castle and Cobb in the year 1966 discusses about three categories of health behavior. They are: first, preventive health behavior. Any activity undertaken by an individual who believes himself or herself to be healthy for the purpose of preventing or detecting an illness in the early state come under this category. For example, a mother getting her daughter immunized against cervical cancer is a preventive measure, or a simpler example of vaccinating children against an array of diseases in childhood like diphtheria, measles, tuberculosis, smallpox, etc. In the present context of COVID-19, to prevent this disease, we are directed to cover with face mask, maintain social distancing and wash hands frequently. This is an example of preventive health behavior. The next category is illness behavior. Any activity which is undertaken by an individual who perceives himself or herself to be ill, to define the state of health and discover a suitable remedy. For example, a person consulting a doctor with the fever, taking it as a symptom of tuberculosis and acting as per instructions of the doctor to undergo further diagnosis. This comes under illness category. Then the third category is sick role behavior. Any activity undertaken by an individual who again consider himself as ill for the purpose of getting well comes under this category. For example, a doctor prescribing medicines and bed rest after being diagnosed with viral fever and the patient following it comes under sick behavior category. Then now we will understand what are the key features of health behavior. Numerous studies have examined the relationship between health behavior and health outcome and also have demonstrated their role in both morbidity and mortality. One of the first such studies is Belloc and Breslau in 1972. This study identified 7 features of lifestyle which are associated with lower morbidity and higher subsequent long-term survival. Amongst these 7 are: first is not smoking, second having moderate alcohol, third one sleeping for at least 7 to 8 hours per night, fourth is exercising regularly every day, fifth is maintaining a desirable body weight, not being obese, sixth one is avoiding snack, especially between meals, seventh and final one is eating breakfast regularly. Do you all have these habits? If you are having these habits, that means your health behavior is very good. Health behaviors also impact upon individuals' quality of life by delaying the onset of chronic disease and also extending active lifespan. Smoking, alcohol consumption, diet, gaps in primary care services and low screening uptake are all significant determinants of poor health, and changing such behaviors should lead to improved health. Now let us see what are the characteristics of health behavior. The first characteristic feature we are going to talk about is that health behavior is complex in nature. This is because it is influenced by beliefs, environment and emotional state or traits of an individual. Further, health behavior is strongly influenced by psychological, cultural, social and emotional factors surrounding the individual. The second important feature of health behavior is its dynamic nature. This means along with time, place, age, social physical environment, health behavior undergoes changes and alterations. For example, a person does not smoke when he or she is in home where he or she will be judged, but they can smoke when they move out of the city for a job or outside the house. The next feature, the characteristic feature is health behavior is considered as a process rather than a discrete entity or a fixed trait. As time and circumstances changes, it will evolve. For example, a person does not become addicted to alcohol suddenly, but it is a gradual process whereby he or she is introduced to alcohol, slowly increase its consumption due to various reasons and gradually reaches the state of addiction. Now finally, the characteristic feature is any health behavior is motivated by a stimulus. This means any health behavior to occur needs a trigger, and this trigger leads to its manifestation of happening. Another aspect in characteristics of health behavior is the relationship between knowledge, values, attitudes and beliefs to health behavior. Any health behavior is basically shaped by 4 factors: 1 knowledge, 2 attitudes, 3 beliefs and 4 values. Having appropriate or correct knowledge is one of the important prerequisite for developing health behavior. It refers to the knowledge people have about health related issues. Individuals are not always knowledgeable about the good or bad outcomes of health behavior, but imparting correct knowledge alone will not always guarantee changes in an individual's behavior. This is because change of knowledge into action is dependent on a wide range of internal and external factors, which includes attitude, belief and values. Values are acquired through socialization and are those emotionally charged beliefs which make up what a person thinks are important. A belief represents the information a person has about an object or action. It links the object to some attribute. Attitudes are value-laden social judgments which possess a strong evaluative component. Sometimes people do not follow good healthy behavior despite having correct knowledge. This knowledge-action gap can be explained by attitudes and values that he or she upholds. For example, in India, most adults who smoke are aware of the hazards of smoking but continue to smoke. This is because either their attitude, value or belief is having more influence on the behavior than the knowledge component. But Is it easy to have good health behavior? I mean good health habit? May not be possible because there are many barriers in health behavior. The process of developing a health behavior can be thought of as operating as a system in which the individual, his or her family, health professionals and also community play a very important role. According to health psychologist Craig Ewart, many interrelated factors and problems can impair the influence of each component in the system, and each component affects each other. Let's look at some of these factors, first beginning with those within the individuals. These are the factors which are barriers to health behavior which come from within the individual. People who consider ways to promote their own health often face an uphill battle with themselves. One problem is that many people perceive some healthful behaviors as less appealing or convenient than their unhealthful alternatives. Some people deal with this situation by maintaining a balance in their lives, setting reasonable limits on the unhealthful behavior they perform. But other people do not, opting too frequently in the favor of pleasure, sometimes vowing to change in future. I'll go on the diet next week or I'll do it from tomorrow. They see little incentive to change immediately, especially if they think they are healthy. Even when individuals know they have health problems, many drop out of treatment or fail to follow some of the recommendations of their doctor. 4 other factors within the individual are also important. First, adopting wellness lifestyle may require individuals to change long-standing behavior that have become a habit and may involve addictions, as in cigarette smoking. Habitual and addictive behaviors are very difficult to modify. The second, people need to have certain cognitive resources such as the knowledge and skills to know what behaviors to adopt, to make plans for changing existing behavior and to overcome obstacles to change such as having little time or no place to exercise. The third, individual need sufficient self-efficacy regarding their ability to carry out change. Without self-efficacy, their motivation to change will be impaired. And the last, being sick or taking drugs can affect people's mood and energy levels, which may affect their cognitive resources and also motivation. Now coming to the next category of barriers, we will talk about interpersonal factors. Many social factors influence people's likelihood to adapt health-related behaviors. For instance, one partner's exercising or eating unhealthy food before marriage can lead his or her partner to adapt the same behavior over the time. The social influence probably involves individuals giving social support and encouragement for the other person to change his or her lifestyle. People who live in a family system may encounter problem in their efforts to promote wellness. Some problems come about because the family is composed of individuals with their own motivation and habits. Suppose, for instance, that a member of a family wants to consume less cholesterol, but no one else in the family is willing to stop eating high cholesterol foods such as butter, eggs or red meats. Or suppose the person has begun exercising 3 times a week, but this disrupts the daily routine of another family member. These interpersonal conflicts which we see, that circumstances like these can create in the family, may undermine preventive efforts that the majority of the family members support. Similar interpersonal conflicts can undermine prevention efforts among friends, classmates at school or college and fellow employees at work also. The next category of barriers comes from the community. Factors which are part of the community. People are more likely to adopt healthful behavior if these behaviors are promoted or encouraged by the community organizations such as governmental agencies and the healthcare system. Health professionals don't usually have accurate information regarding their patients' health-related behavior, and they have traditionally focused their attention on treating rather than preventing illness and injury. But this focus began to change some years ago, and doctors became more interested in prevention. The larger community faces an enormous array of problems in trying to prevent illness and injury. These problems include having insufficient funds for the public health projects and research, needing to adjust and to communicate with individuals of variety of different age groups and socio-cultural backgrounds, and providing health care for those who need it most. In some communities, a lack of safe and convenient places to exercise, a high number of fast food restaurants can also impair health promotion. Also, people's health insurance may not cover preventive medical services. Among the most difficult problems communities face is trying to balance public health and economic priorities. For example, suppose the surrounding community of an industry is subjected to, say, potentially unhealthful conditions such as toxic substances, but the community heavily depends on the industry for jobs and tax revenue, and the cost of reducing the potential of harm would force the company out of business. What should the community do in such situation? Many such dilemmas exist in most societies throughout the world. Health behaviors have important consequences for both the quality and length of life by influencing disease outcomes. Nevertheless, there is still considerable variation in those individuals who perform these behaviors. Understanding and improving health-related behavior is very critical to the future of public health and to the well-being of individuals, and has become central to public health activities. While policies, laws and regulations can affect health behaviors, there are also many individual factors that must be considered in these public health efforts. Change is incremental. Many people in their lifetime have practiced health behaviors of one sort or the another. It is unreasonable to expect that significant and lasting changes will occur during a short period of time. Public health programs need to identify and maximize the benefits of positive change, pull participants along the continuum of change, and consider changes in educational programs and environmental supports to help people to maintain changes over the long term. Now let us summarize what we have learnt in today's lesson. Health behavior is any activity people perform to maintain or improve their health regardless of their perceived health status. It has been noted that people's health status influences the type of health behavior they perform and their motivation to do it. Three categories of health behaviors are preventive health behavior, illness behavior, and sick role behavior. Coming to the characteristics of health behavior, the main characteristics of health behavior are: it is strongly influenced by psychological, cultural, social and environment factors surrounding the individual. The second feature of health behavior is its dynamic nature. Next, health behavior is considered as a process rather than discrete entity or fixed trait. Then comes any health behavior is motivated by stimulus. Finally, any health behavior is shaped by four factors, which is knowledge, attitudes, beliefs and values. But inculcating health behavior is not an easy task. There are various barriers to health behavior. Some of these barriers come from within the individuals, some of them are interpersonal or social factors, and other factors come from the community.